First symptoms of kidney failure. Recognizing the first symptoms of kidney failure is crucial for early intervention and better health outcomes. Some common early signs include fatigue, swelling, and changes in urination. Fatigue often manifests as an overwhelming tiredness that doesn't improve with rest. Swelling, particularly in the legs, ankles, or around the eyes, can occur due to fluid retention when the kidneys are not functioning correctly. Additionally, changes in urination, such as increased frequency, decreased output, or even foamy urine, can signal that something is amiss with your kidney health. These symptoms can easily be overlooked or mistaken for other issues. For instance, fatigue is a common complaint that many attribute to stress or lack of sleep, while swelling might be dismissed due to a long day on your feet. Changes in urination can also be attributed to dietary factors or temporary conditions. This is why it's essential to pay close attention to your body and recognize when these symptoms persist or worsen. If you experience any early symptoms, seeking medical advice promptly is essential. Early detection can make a significant difference in managing kidney health and preventing further complications. A healthcare professional can conduct the necessary tests to assess your kidney function and provide guidance on the next steps. Remember, being proactive about your health is critical, and understanding these initial signs can empower you to take action before more serious issues arise. Your kidneys play a vital role in your overall well-being, so don't hesitate to reach out for help if you notice these symptoms. When to seek medical help. Understanding when to seek medical help for kidney issues is vital for maintaining overall health. Timely medical intervention can make a significant difference in managing kidney conditions and preventing severe complications. If you notice any concerning symptoms, it's essential to consult a healthcare professional as soon as possible. Some warning signs that prompt immediate medical attention include severe swelling in the legs, ankles, or face, which may indicate fluid retention. Additionally, if you experience persistent fatigue, shortness of breath, or chest pain, these could be signs of kidney dysfunction. Changes in urination, such as blood in the urine, foamy urine, or a sudden decrease in urine output, are critical symptoms warranting prompt evaluation. It's important to remember that kidney issues can often develop silently, so being proactive about your health is vital. Regular checkups with your healthcare provider can help monitor your kidney function and catch any potential problems early. During these visits, your doctor can perform tests to assess your kidney health and provide guidance on lifestyle changes that may be necessary. Encouraging viewers to stay vigilant about their kidney health is essential. If you have risk factors such as diabetes, hypertension, or a family history of kidney disease, make it a priority to discuss these with your doctor. By being aware of the warning signs and maintaining regular checkups, you can take control of your kidney health and ensure that any issues are addressed promptly. Remember, your kidneys are crucial to your overall well-being, so don't hesitate to seek help when needed.